All right, this video is going to be about assisted reproductive technology, or ART. As I've already said in a previous video, that A does not stand for artificial. You're using a real reproductive system, and a real infant could result if everything aligns and it is successful. It's not always, just like trying to get pregnant the old-fashioned way through sexual intercourse, it's not always successful. All right, but let's talk about let's first talk about what ART is. And so this involves medical technology that is meant to address fertility problems. Now, fertility problems can include something like you don't have any sperm because you're two females trying to have a family together, or a single person wanting to become a single parent on purpose. Both of those will happen. Or you could be a couple where you've experienced infertility, you've been diagnosed with infertility, and you want some assistance. You want to have more control over the process, or increase your odds of conception, or increase your odds of a viable pregnancy. Some individuals will have repeated pregnancy loss, where they know they've had documented pregnancies, but they didn't continue past a certain point. So they will know, well, I don't have problems with conception. I have problems with maintaining, with continuing. So and sometimes doctors will try to figure out what's going on there, and very often the answer is we don't know. We don't have any known cause for this, and again, it could be bad luck when that happens. All right, so assisted reproductive technology involves various procedures to get around issues like problems with sperm, like low sperm count, poor sperm motility, blocked fallopian tubes, problems with ovulation, problems with implantation when there are known causes. All right, so what are some of the things that are available? One of the things that's available is just using fertility medication, fertility drugs. You can hyperstimulate the ovaries, and sometimes that helps individuals who have problems with ovulation. You could also, when you do that, you have to be aware that there's increased chance of multiples, because dizygotic twins or triplets or quadruplets could be possible, because sometimes hyperstimulating the ovaries means more than one ovum gets ovulated. You can also use procedures like intrauterine insemination. Again, not called artificial insemination. Intrauterine insemination, or IUI, where sperm is inserted into the uterus of someone who has a uterus. All right, so typically this happens in a medical office. A tube is placed in there, and sperm that's been deposited, donated earlier, and it could be from an anonymous donor, or it could be from a partner in a situation where you've got opposite sex couple, and maybe they have concerns about the husband's or male partner's sperm. And so the idea with IUI is if there's sperm present, the idea is that sometimes they just want to give it less distance to swim, giving it greater chances of the sperm getting there. And then sometimes you use donor sperm because you have an individual where it's a single individual, or it's a same-sex couple where they don't have their own sperm, they need a donor. Or you also can have donor sperm because somebody has a situation where they don't produce sperm, or not enough. They might have had testicular cancer or something like that. There are various situations where sometimes IUI is performed because you're using donor sperm. All right, so IUI is one option. IVF is another one. Now, IVF is the most complicated, most expensive option too. And IVF, it's a technique where one ova, well, it could be more than one too, but let's do the default setting. One ova is surgically removed. You do have to have surgery for this procedure. And typically this surgery happens after the person with the ovaries has been prepped in some way. They've often been taking medication to hyperstimulate the ovaries. Sometimes they've been suppressing their cycle beforehand in prep for the procedure. And so when they're ready to ovulate, before the egg is released on its own, they surgically remove it, or sometimes more than one, but they surgically remove it, and fertilization takes place outside the body in a petri dish. And this can happen by just letting sperm swim to the ovum, or you can inject the sperm directly into the ovum, but the fertilization happens outside the body. It's a very complicated process. Once fertilization happens, though, you are not done. You still have to have implantation in a uterus, either a surrogate's uterus or the individual who you got the ovum from. Sometimes it's a surrogate, sometimes it's the same individual. And then sometimes when people report on IVF, they will say, oh, and then that fertilized egg, the blastocyst, then that blastocyst is implanted in the woman's uterus. No, you cannot implant something. It is not a verb. You can transfer it. You can place it in there and then cross your fingers and go, okay, implant, 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 please implant. And sometimes it does. Many times it doesn't. All right, because you can only control so much of the process. Implantation is complicated for in vivo conception. It is also complicated for in vitro conception or fertilization. Right, so IVF, it also will often involve multiples because, first of all, you could have monozygotic twins. You could have a split, but also because some individuals, by the time they're doing IVF, they've already tried everything. So sometimes they will up their chances of having a successful procedure by transferring more than one blastocyst or fertilized egg. And so sometimes that means they will get twins or triplets, and the doctors will sit with them and they're like, do you understand that, you could get 0 babies or you could get 3 babies, that sort of thing. All right, so that's what you need to know about assisted reproductive technology. The next thing I'm going to talk about in the next video is when you lose those abilities altogether and you have menopause. And then andropause for men, where you don't lose all the abilities, but you do have declines. Stay tuned for that.